Batisi TV. Lone Rashapi Daka Frank Motors. Kajaka Dekali Gabatamai Junka Tata Motors. Halatko Ni Shillong. Rinkat Bakanet Foodish. Ordar Mapi. Ninwan Ramani. Hakir Dobying Jompi.
Kumba Saulak Tylli ki Longïing Haganiga Jilla Meghalaya kilayo jing Myntoi lingba ka scheme Ayushman Bharat bala pentraikam da ka sarkar pedeng habaro ka waikari India. Yakani la pentib do Chief Executive Officer jangka National Health Authority URS Sharma hakajing yakran mat kilat pathai khubor hakajing ilang haka State Convention Center Shillong haka la sngiu blai jangka arpulai tarik ubna jemmang arajar arpuar. Haganiga jingelang URS Sharma ulayatho bagajing pensdang ka Ayushman Bharat Digital Mission kalanang pensuk shosho ki padba ban penrung kerteng yaladi na kabenta ban yo yaki la jingerap habaki pangki shitom bat habaki late sumar hakino kinoki hospital ki badan hapo kaniga jilla.
The Pradhan Mantri Jan Arogya Yojana, as you know, seeks to provide cashless treatment to 40% of India's population, and 8 states which are participating in this conference, basically all the northeastern states, all the 7 sisters, and I think Sikkim also is now included. 8 sisters. So they are all participating, and all of them are doing an excellent work in this whole scheme. So that, I've been hearing the leadership of all these states, and they are all very, very committed and passionate people, and especially imagine the health, has become very important work in today's context, especially in the pandemic period, and therefore we find that all of them are extremely enthusiastic. They are adopting technology, they are adopting the latest, sort of means and latest rates, which for various diseases. So I think they are doing great work, and we are all very happy. We also exchanged a number of ideas. For example, Meghalaya, the Honorable Deputy Chief Minister who had come to launch this workshop in the morning, he shared with us the Panchayat level group,
Village Health
Council, which he had which the government of Meghalaya has constituted, and the kind of work they are doing. They are basically the frontline, workers or frontline group, which basically tackle any kind of emergency in the villages, and that I think is what is required for any health delivery system. Unless it is connected to the grassroots, unless it is connected to the basic ground, things will not work. And I think this is a great idea which we are all taking with us, and I think we will try to convince other states also. Today also we have talked to other 7 states to implement this idea. So I think the purpose is to basically bring such ideas, such implementation ideas which succeed at the state level to the government of India, and then share them again among other states. So it has been an extremely successful day 1 of the conference. We will continue tomorrow also. And I think we will then hope that the program, both the program, the ABDM and PMJY, they get accelerated. The statistics which Meghalaya in their presentations presented basically indicated that we are very successful. They are very successful in Meghalaya, especially when you have a very committed set of officers here who are ensuring that nobody is denied, nobody who is eligible is not denied treatment. The point is that we don't want everybody to fall sick, obviously. We don't want to increase the statistics of people getting hospitalized. But what we certainly want is that anybody who gets sick, anybody who needs hospitalization and who is actually a beneficiary of ABPMJY is not denied treatment. So that is the parameter.
Meghalaya, in fact, we have been giving the presentation so far. Over 290 crores was actually claims have been settled under the health insurance scheme, and at the same time over 4 lakh households got benefited out of it, and 175 hospitals are actually connected with this insurance scheme across the state and also outside the state. So there is a helpline number, there is a national helpline number. In fact, this is what we have discussed in today's meeting. there are a lot of, there is something that there is a need for improvement even in the helpline number. So that also is going to be, we are going to be part of the national helpline. So one challenge is like across the states, of course, sir also will be telling you. One is that connectivity issue everyone was mentioning, especially in the remote areas when we go for a registration. It's a kind of a challenge because it has to be, online, so that there will not be any duplication or anything. So those are the things. But at least for the state of Meghalaya, so like more than 60% of the households are covered in it. Actually, there is a total. If you look at for every family, up to 5 lakh rupees, actually this can be covered, and it is covered. And again, there are a lot of packages, around close to 2,000 packages are there. And now there is a health benefit package 2022. It's been its new thing is coming up, and we are going to bring it very soon, in a month and so. Once this is that actually package actually will address some of the issues what you are mentioning. A new health benefit package which is going to come. As far as SCCC beneficiaries are concerned, yes, it is actually, in fact, this you can ask all the private hospitals also. They actually take care of the entire burden. And non-SCCC, that is non-BPL beneficiaries, of course, there is some kind of there is a set particular packages accordingly that is paid. That too, again, as I said, under the packages up to 5 lakh per family can access services.
During the pandemic, we have seen people have started using digital means. People are making WhatsApp, sending pictures to the doctors, calling video calls, and then explaining the symptoms or explaining the problems. Doctors are prescribing medicines on the system. So all that has been happening. So the ABDM, the digital mission, has come at a time when we have all become quite comfortable with using technology to basically access health services. Many times we are getting the medicines also delivered online using the prescriptions, sending the prescription copy and then getting the medicine. So I think that has started a very good movement towards digitization. And I believe, and we all believe, that digital framework creation which has been done by Ayushman Bharat Digital Mission is actually start a completely new era of delivery of health services and using technology to deliver that, which will make things less costly, which is affordable because you don't have to travel. It will become accessible because then people from remote areas can also access it. It will also provide longitudinal health record to the doctor so as to make better diagnosis. So there will be multiple benefits. It has to start, and as you yourself, some of you yourself said about the low connectivity problem. In fact, this is something which was discussed, and this is the biggest challenge of the Ayushman Bharat Digital Mission, especially in areas where connectivity is poor. But let me also give you one particular statistics that today India has got 1.2 billion mobile connections. There are only 25,000 villages in the whole country, about 6.5 lakh villages, which do not have connectivity. So I think slowly the connectivity space is increasing. It's actually becoming better. India today has 4G connectivity. And for health facility delivery, communicating the medicines, communicating them, it does not take a very large bandwidth. However, we should not ignore the connectivity problem. I think what I am going to do is, when I go back to Delhi, I am going to talk to the TRAI and the Department of Telecom to say that kindly ensure that we have better connectivity, because connectivity gives you a sense of nearness, sense of being connected, sense of being the main participant in the whole process. So connectivity is extremely important. So I think we will continue to work, because that is the basis of having any kind of digital system. So that is one challenge which we have realized in the Northeast. Of course, we knew it from before also. For example, even in Ladakh and some other areas, now the connectivity challenges of Andaman Nicobar and other places have been solved. Why it has been solved? Because there is now a fiber line, which is undersea cable, which has gone there. Now there are some hilly areas, specific terrain related issues, which I think we will need to sort it out.
It was done during that thick of the COVID vaccination drive, and it was basically we were experimenting how that can be used. In fact, drone technology, usage of drone technology, because that's one of our state capability enhancement ideas. How actually you are using technology and data for strengthening the entire state capacity. So definitely, as you were also mentioning, as Sir was mentioning about how important it is to bring some kind of those ideas, and also very high fidelity telemedicine facilities. So working on it, but yeah, that is what the Ayushman Bharat digital mission is going to provide a huge opportunity for the states like us, because we have though we are a smaller state, but we have a huge number of villages spread across, like we were sharing this one. It's very challenging. So we have to really find out different ways and mechanisms how actually we can use some of these technologies to deliver services to the last mile population.